BrainStorm. BrainStorm 9000.
Hello, everybody, and welcome to our latest installment of BrainStorm 9000. I'm here with Dr. Schultz and the lovely Virginia Reath.
Hi, everybody.
Hi, everybody.
So, Virginia, this is our third attempt to record. So, the first time Virginia came, it was at the very beginning, at the baby stage of the project that turned out now into this great BrainStorm 9000.
It's a whole storm. It's a storm of brains.
Yeah, so before it wasn't a storm, it was very quiet, except for one person who is not even going to be hearable or visible to anybody. And so we basically lost the episode. Then Virginia came and spoke to me. I have to admit, I'm a heterosexual man and know very little about real issues that women have. So now we have Master McMaster.
I am a woman. I self-identify as a woman. I'm biologically female. If we want to do the gender binary distinction.
Oh, we have to announce ourselves, I suppose.
Not really.
I mean, it doesn't.
Yeah.
You don't have to
Okay, I'm
self-identify.
a female.
Yes,
I have a uterus and a vagina.
I have those too.
I guess, is that what you said?
I'm not going to say what I have.
No, that's private. You keep that to yourself.
We know what you have, Ed.
No, you don't. Okay.
Well, that is true.
Yeah, so,
All right, moving along here.
Virginia, tell us a little bit about your background and what you specialize in.
Well, my name is Virginia Reath. I'm a physician associate in gynecology and women's health. And I also am a painter and a visual artist.
Love.
And I guess many years ago when I was a young art student and politics was brewing, and I was very active in the anti-war movement and the women's health movement.
The anti-which war movement?
Oh, sorry, anti-Vietnam, anti-war, the Vietnam era.
Yes.
I'm old. So anyway, I during that time when I was in college, a friend of mine had said, wow, she had these really cool people, these two women come to Brown University and give a workshop on self-help exams. And I was like, what's that? And she had this plastic speculum. And she said, you look at yourself and you learn how to take care of yourself by checking yourself.
Is the speculum the thing that opens you up?
Mm-hmm. Yeah, the plastic or metal duck bill.
Oh, I hate
right?
those.
Well, that's why, so anyway, I started this self-help group at Bard College in 1972. And we actually made a film, which is pretty funny. But, and then I started doing workshops. And it was all of a sudden I realized, wait a minute, this world is calling me as political work, because I was also, as I said, a painter. And at that time, people were saying painting was dead, and art was bourgeois, and conceptual art was really heading in strong. And I really that didn't interest me. And I was also being taught by a lot of really angry, resentful male post-abstract expressionists.
Oh, those ones.
Yeah, those teachers. So I was part of the Feminist Alliance, and we got great people like Elizabeth Murray, who became a friend, and Jenny Snyder, and Carolee Schneeman. And so it was a great time for me. But anyway, I came back to New York, lived in Tribeca, right up the street, went to NYU pre-med, and I ended up entering the program at Hopkins as a physician associate. Came back to New York. There were no jobs then, and I really wanted to work in women's health. So I slowly started working at family planning centers and at abortion centers. And so that was my area of expertise. And then over the years, maybe it was the artist in me, maybe not, but over the years, I really felt that medicine was just that the way I was practicing and what medicine and gynecology had to offer was incredibly narrow. I had a repertoire of hormones, steroids, antibiotics, and that was about it, and surgery.
Mm-hmm.
And so that's at that time I started developing an interest in integrative medicine.
What era was this?
This was the 80s.
Okay.
So it was relatively new,
Mm-hmm.
and so I started getting referrals from homeopaths You know, those quacks.
Oh, yeah, those ones.
Yeah, let's not
Dr.
talk about
Schultz is only that. So I started learning a lot of what was working for their patients. I started incorporating a lot of that into my practice. So I got kind of known as being someone who did alternative or integrative options for women in gynecology. And then at the same time in the 80s, I started seeing I was young, but I started seeing a lot of women who were in their early menopause or menopause. And the only real available estrogen replacement therapy at that point was Premarin, which is made from horse's urine, pregnant mare urine. That's what it's called, Premarin.
Oh, God.
And also that a lot of heavy use of a synthetic progestin called Provera or methyprogesterate. And I began to see people really do badly on that.
This is early birth control?
That was actually hormonal therapies, HRT for menopause.
Right. Okay.
What is HRT?
HRT is hormone replacement therapy.
Okay.
So the two areas are interesting because they overlap. In fact, the birth control pills are actually stronger than a lot of the HRT, which women don't know. And it was at that point in time, after the 70s, when the IUD had blown up. So no one was putting in IUDs unless you had children, unless you signed all these documents, right?
What is an IUD?
IUD is an intrauterine device. And what it does is it creates a mild inflammation that's undetectable, usually to the body. Well, at that time, they were made of lots of different types. But at the time, the most common one was something called the copper T. And that still is around because we had, at the time, in the early 70s, these IUDs were blowing up. And there was a huge episodes of women who had lost their fertility. There was PID. There were major problems in it.
Because of the IUD? Because
of the IUD, well, that's been somewhat controversial, but yes, the certain IUDs were really dreadful. Like the Dalkin Shield was one that embedded itself in the uterus or embedded itself in the tubes. Yeah, it was not they had a Lippes loop and a Dalcon, and there were lots of different ones. So the contraceptive history in that period, post 70s, 80s, was being heavily pushed in the later 80s. Heavily pushed towards hormonal contraception, which was the pill.
Because initially the idea was to inflame the uterus to make it angry so it doesn't accept babies.
Well, it was, to some low degree, yes.
Right.
But then what happened was we started lowering the dosages. I mean, the first dosages of the pill were extremely high. And you wonder just how crazy half those women in the 60s and early 70s on those pills were.
I have an educated opinion about this because the beginning of my illustrious career in the United States, after I was done cleaning the dishes in one of the Russian restaurants when I just came, I was able to get a job at the Columbia University Neuroendocrinology Lab, which specialized in neuroendocrinology of a female reproductive axis. So basically we were looking into how the hormones that regulate the female body work and how they relate to each other. So just to give you a very short overview, ovaries make hormones. Brain reads the level of these hormones and tells the ovaries whether they're doing okay, meaning basically is silent, or they are producing too much, or they are producing too little. Two main regulating hormones that are released from the pituitary, this small little thing inside of the brain that we can show people maybe on our website or on our blog, releases two important hormones, LH, luteinizing hormone, and FSH.
Follicle stimulating hormone.
It's dynamite. Yeah.
I have never heard of these. I thought we were going to be talking about estrogen and testosterone.
No. Okay, so women do make testosterone, but female testosterone is made by the adrenals, and the level is low but high enough to influence the sex drive, meaning enough testosterone, sex drive. But also the ovaries produce progesterone and estrogen in a cyclic manner. And I let the pro Virginia talk about it. But what I wanted to tell people that if somebody comes in and suddenly, rather unnaturally, increases the level of any of or both of the peripheral hormones, brain is going to complain. What it's going to do is going to shut down. So there's going to be less of LH and FSH, because this is the language. Shouting for the brain would mean to increase the level of LH and FSH. Shutting up would be decreasing it. And in the lab where I worked, we actually published numerous papers which show very clearly that these hormones mediate stress. So should FSH go up or LH go up significantly, actually any change up and down, a person feels very stressed.
So I think we're always caught, and the history of women in medicine is really fascinating in this way, because women in medicine have a very odd, both antagonistic and symbiotic relationship. So we've seen that throughout the years of, the centuries of medicine. But here's a situation where women are wanting some sort of reproductive control.
And I think I just want to throw in here that for the purposes of this conversation, we're talking about different kinds of birth control for different sexes, but we're not endorsing a binary view of sex and gender as, there's only males and there's only females.
No, we're talking very specifically around contraception, the need for contraception, the use of contraception, and that is for mostly for women whose options are who looking for contraceptive options.
What you were trying to say was around an interesting role that women
but no, meaning that there's contradictions constantly, that women are being asked to either take something that might be harmful to them or not beneficial to them to get the means that medicine is offered. Right? So you're up against the wall. And that's one of the things that we see constantly in this field of, you had asked me a question of what's the difference in contraception, what's the difference in the pill makeup. So one of the things we're seeing now, because what was happening in the 70s into the 80s was that we had the beginnings, we were still fitting for diaphragms. The cervical cap was very popular. But then what happened is medicine said, I don't have the time for this. The doctors didn't want to pay the time to fit a woman for a cervical cap or for a diaphragm. And then what we did was we kind of created a culture of women who were like, ew, I hate the diaphragm. Ew, it's messy. Ew, it's unattractive looking. Ew, I don't like to be the one who has to do this. So what did everyone like? The discretion of the pill. Nobody knows you're on it. You get to be clean and neat and tidy.
Yeah, you get to act like you're not making a big deal about it.
Yeah, and you get to act like there is no connection between sex, heterosexual sex, and reproduction.
Yep.
So now you get the beginnings of that split and divide, that ignorance, that lack of actual consciousness around sex and reproduction.
Yeah.
It's not just sex and reproduction. Let's put it bluntly. Sex and pregnancy. All right? So then if you look at it historically, which is a fascinating time, we also had, during the 80s, right, huge AIDS crisis. Right?
Yeah.
We also had an explosion of the beginnings of HPV, human papillomavirus.
Which now, everyone has, right?
Well, which has become pervasive, yes, absolutely. But if you looked back then, right, we were seeing women who were not having it on the cervix. We were seeing women who had it on the vulva and the vagina. And literally, and I mean lots of nice white women, if you want to talk about it that way, were coming in, nice 25-year-old women covered in warts. Well, the point being was so there was a motivation to use condoms. There was an acknowledgement of the sort of wait, you and I are doing something together that affects me.
Yeah, because of the sexually transmitted diseases.
Absolutely.
Not necessarily pregnancy.
Right. And you see then, but everyone talks about decrease of syphilis and gonorrhea, a slight increase of chlamydia, HPV is on the rise, HIV is on the rise. Big motivating force.
Yeah.
Big motivating force. Study comes out. It says, guess what? Women get AIDS from men. But guess what? Men don't get AIDS from women.
How does that work?
Well, it's not as high as a risk factor.
Huh.
Women are way more at risk for getting HIV from men than men are from women. What happens then? What happens is you start seeing, okay, you also have shifting relationships between heterosexual couples.
Yeah.
Right? You also now have a whole pregnancy phenomenon, right?
Mm-hmm.
Here's this phenomenon of how long can you wait? When I was practicing, we were telling women they could have children in their 40s. All right? I have girls at 27 years old who are coming into my office asking to freeze their eggs. All right?
Today,
so
you mean
today.
today.
So we have a paranoia. 30 years old. Most of the women I know, young women, really believe that they better have a plan by 30.
That's how I feel. I'm
Exactly.
turning
And where
29
did that
this year.
happen? And why is that so? The idea that you have suddenly not about relationship, not about intention, not about who you are, about your pregnancy deadline.
Yeah.
All right? So that shifts the entire landscape.
Mm-hmm.
You put all of this together, right, historically, right? Women start getting anxious about what they want, but they can't find a partner, but they have to hook up. They got to keep in the game, right? Men don't want to use condoms.
No,
Right?
they don't.
Exactly. So what happens? Men stop using condoms. What are women's options? More permanent, longer contraception.
Mm-hmm.
So they now are up against the wall. They have to be on the pill or take the risk of a pregnancy. Now you have a generation also who has no idea that what the impact will mean when women do not have the ability to be free in their choice making around reproduction.
Which generation are you talking about right now?
I'm talking about both millennials and younger and older.
Okay.
Because I'm saying there has not been a consciousness, I don't think, to say we will not accept a position where abortion is not going to be a free and easy choice to make and be able to execute in our lifetime.
It's shocking to me that it's still such a hotly debated topic.
Yes, but it's hotly debated, if you think about it, by men who have absolutely no consciousness of sexuality and sex. The question that journalists should be asking senators, congressmen, and everyone in the government is, what kind of birth control do you use?
Mm-hmm.
Because we have to say, you're having sex. That's what people do.
Yes.
All right? A lot of people have sex because we also need, as Ed will talk about, this is human. This is about connectivity.
Sex is awesome.
Sex is awesome, but not even, I don't mean, sex is also just basic.
Mm-hmm.
It's very, very basic human need.
Yeah.
It's a human means of connectedness and exchange and intimacy and safety. We take that away from the landscape, we've got a whole different story happening.
Yeah.
And that's what I think is happening.
And I can tell you, to me, it's both upsetting and amazing, because while, Virginia, you were doing your stuff with your PA, I was a physician's assistant in Moscow. I graduated the physician's assistant school and quickly became just a title, the best PA of Moscow. I have a diploma. I mean, I went to a competition, right? And I actually worked in the ICU kind of setting. And I'll never forget when during my training, we saw a married woman who had an illegal abortion performed on her.
Because all
Mind
abortion
you.
was illegal at that
No,
time,
abortion
right?
was legal.
It was
Oh.
legal. I
Yeah,
mean, you
but-
could see sometimes in Russia, I had patients who sometimes had 15 abortions.
Yeah, so abortions in communist Soviet Union.
Well, that was a form of contraception, though.
Yeah.
Yeah.
But
It's the only
abortions.
one.
Oh, it just
no,
sounds like
of course not.
that's
Of
such a
course,
toll.
you could buy condoms freely, and the pill wasn't that popular. But what I'm trying to say is this: even in the situation when abortions were totally and completely legal, there are going to be situations when a woman needs, for one reason or the other, her family members not to know that she's performing an abortion for whatever reason, age, I don't know, extramarital
Shame.
sex.
It's just
Yeah.
Stigma.
It's a story.
So she was basically dying. She didn't die. She
Oh.
did not die, but she was dying after performing an illegal abortion. So to me, it seems that abortions are going to be performed and asked for regardless of the regulation.
Absolutely, which is why a lot of people now, a lot of women now, a lot of clinicians now are being trained in how to do early abortions and manage abortions, and we'll do it underground. We'll do it. But what I wanted to get at really is sort of like, how does this impact the kind of role then of gynecology now?
Yeah.
So if Western medicine is now turning into a very corporate speed trip,
Mm-hmm.
I mean, a GYN exam can go in about 7 minutes.
Mm-hmm.
Okay.
Seriously?
7
Yeah.
minutes.
There's no conversation involved?
Very little. I mean, if you're looking at a setup of a managed care office where you're seeing between 4 to 6 patients an hour.
Oh my God.
That's pretty quick. They look in there.
They look in there, they do a little pat, pat, pat. They do this. They maybe listen to your heart, or they've gotten their medical assistant to do it, the
Yeah.
blood pressure. Then done. You're out. Here's your prescription, because that's it. Now, here's what else. We now have a phenomenon where we used to think the pap smear was the reason to go to the gynecologist.
Let's tell people why it's called pap smear, because the name of the guy who invented
Was
it is
Papalacoma.
Papandopoulos.
Of
Right.
course, it's named after him,
Papandopoulos.
yeah.
But
Greek.
that's another, that would be
Yeah.
a fun thing, because that's the history of gynecology, which is fascinating. Every anatomical phrase that naming that we know has been named by a man. Fallopian tubes were named by Fallopius. Bartholin. The G spot is named after Dr.
Oh,
Grafenberg.
come on.
Yeah. So anyway, but that's, we're digressing there. But the point being is that I think what we're seeing now is what they want, what both government wants, and also what women want, because their choices are small, but they're not recognizing some of the inherent health risks.
Mm-hmm.
We now have an increase of the IUD again. Now, the IUD is now one of the most popular contraceptions.
Really?
Yeah.
Hormonal or?
Well, that's the interesting thing. Now, this fascinated me. So we started off with the Mirena being a particular kind of hormone embedded, progestin, not progesterone, progestin, synthetic progestin.
Can you explain the difference, please?
The difference is naturally occurring progesterone is fairly well tolerated by the body, and it acts as a nervine, and it's one of the hormones that we make.
Can it make people depressed?
Progesterone, for some people, yes. For other people, it can be a great thing for people who have estrogen-regulated anxiety. So
Meaning,
adding progesterone, not progestins.
Mm-hmm.
So progestins is synthetic progesterone.
Right, just to spell it out for our audience. So some people's brain is more sensitive to estrogen. So if they have higher estrogen level, or sometimes normal estrogen level, it can drive people to feel depressed. So adding progesterone, the natural component, could help them not to feel anxious and depressed.
True.
Right?
But the progestins have a slightly different action, and they're much more associated with weight gain and depression. Big aspects of depression. So what we have now, this first Mirena was developed to help control very heavy bleeding in women and cramping. People with endometriosis, women with endometriosis. Then what happened was it became everyone, I'm not sure how it was pushed, and I'm actually doing some research on it now, but it was very heavily pushed. So almost everyone you see is on the Mirena. Many of the young patients I see have been on the Mirena. And
IUD.
IUD. Good for the copper IUD, which is the Paragard, is good for over 10 years. The Mirena is good for 5 to 6, and soon it'll be longer, I'm sure.
Are they told when there is an initial consultation about what you just said?
You know what? I have to say, I don't think so because I have a lot of colleagues who tease me and think that I'm being overly sensitive about progestins, but I happen to believe that progestins are really a very I don't want to be totally hyperbole here, but I don't like progestins, and I think they're somewhat dangerous. They have had studies showing that I think they will be looked upon as the potential harmful agents in the development of breast cancer. I think also they really has significantly affect depression and also both brain issues as well as heart issues. So
whatever it's worth.
I don't like that much. Have I used it? Yes, of course. And you've been in an appropriate patient. I'm going to do that if that's going to help her.
Mm-hmm. So whatever it's worth, I would like to give my 55 cents on this issue.
55 cents, my goodness.
Because I've done research in this area and understand on the intimate, no pun intended level, any additions of hormones from the outside are going to affect the way the brain functions, because the brain is designed to be sensitive to what I would call, in a fancy schmancy way, the endocrine milieu. Of our body, meaning it's suspended
that's what you
in the
said
environment
before.
of hormones.
Yeah.
So if you add or remove anything, it changes human behavior. For example, it's very well known that if repeated sexual offender has enormously high levels of testosterone, decreasing these levels, and there are two ways to do it, I'll let people use their fantasy world, significantly decreases this type of behavior through basically removing testosterone from the picture.
Huh. So
that's controversial. I mean, you're gonna change behavior, but there's a lot that goes into behavior that's
of
not
course.
only.
I'm not trying
only,
to.
You're not on the castration wagon.
No. I'm not on the castration wagon here. But what I'm trying to say that if somebody who's been diagnosed with enormously high levels of testosterone,
yes,
does exhibit this type of behavior.
Yeah, we see that even in women. We see. I mean, I've seen it in women who take, are all on testosterone and who get. One of the things I say is you need to tell somebody that you're on it, and you need to make sure that within the first 3 months, someone's aware of your behavior, because there are people who get very aggressive, and I've seen this in trans.
So if they voluntarily,
they suddenly get way more aggressive.
Right. So if they voluntarily, after being informed, and I would like to underline it 3 times, after being informed that it could be a contributing factor, decide that they would like to look into it, then there are means to control it without physically castrating a person.
Right. There are.
Yeah. So what I would like to concentrate on here is this. Hormones are a part of a very complicated set of factors that form our behavior.
But I think that what we would agree on is that now if you have a generation of women who've been taking hormones since they were in their early teens.
Like me.
Yeah. What does that do?
Yeah.
And we have not looked at that. If you look at the committee on doping, right? They talk about steroid abuse.
Mm-hmm.
Okay. I don't mean to be completely rhetorical here, but what are we doing to a whole generation of women?
Yeah, because I mean, in my generation, the pill for people who aren't sensitive to like blood clots and things like that is extremely common.
Yeah, it's the most common contraception. So when you asked me earlier what also is the difference between the pill even when I was a teenager to now, is that we've been able to reduce the amount of estrogen. But the problem is that we've also now developed a lot of different progestins.
Right.
So we had, for instance, the whole Yaz phenomenon?
I had taken yes.
Okay, so when Yaz had that whole issue, it was thought not to be the estrogen component, but it was thought to be the progestin component,
What issue
synthetic
did it have?
progesterone.
Just to tell people.
Higher risks of DVT,
So DVT stands for
deep vein thrombosis. So I think to go back and sort of look at that, so one of the things I'm trying to promote are non-hormonal contraceptives, and also trying to promote a more equitable notion of what are you doing when you're having sex? Because you are putting, that's part of the slow sex movement also. This idea that we have to erase our reproductive capacity, that disconnects us from what's happening. That is what happens if you want to get pregnant. It's the responsibility of both partners. But what we've done is we've dumped it on women again.
Yep.
Okay? And that's what we had done in generations before. So what I'm saying, to the point you made about abortion, why are men continually treat women as if they are usury, not equals, but usury objects in their sexual engagement?
Yeah, and that's not to, it's certainly...
And that sounds an extreme remark, I realize that, and I'm saying it to be radical.
Yeah, of course.
But I'm trying to make a point, which is, when are men going to recognize that they too are responsible for contraception?
Well, and even so, what you're saying sounds like something that maybe like, oh yes, of course, before the women's rights movement, women were suppressed and men treated women like less
and men
than,
carried
less than
condoms
equal.
in their wallets because they didn't want to get a disease, and they didn't want to get pregnant because they would be held responsible.
But so nowadays there is more of a cultural conception that, okay, like on the surface at least, yeah, like women are equal and women can have jobs and women get paid almost as much as men, and there are a lot,
Not quite.
like a lot of men, like every man that I've ever dated would say, like, of course I consider women to be equal and of course I care about this, but not to generalize. I think there is still this assumption.
Why do we give power away? And why do we continually give power away?
Yeah,
because the idea that we have reached a point where women are equal is bullshit.
Yeah. I consider myself a feminist, and all of the men that I've dated are feminists in their own way. But when it comes to sex and the responsibility of contraception and protection, it has always fallen on me. And
exactly.
And
I remember a guy saying to me, coming inside a woman is saying basically, I don't give a shit whether you get pregnant or not.
So
so if we actually start putting that back out into the world, okay, that idea that what are we doing? Because when the splitting that happens, like what we were talking about earlier, what happens? I was 18 years old. I knew full well I was a women's health activist at 19 or 20. I'm looking at the diaphragm on my chest of drawers while I'm having sex. And what happened? I got pregnant. And what did I have to do? I had an abortion. What happened then? That split is something I see happens every day with women. And that's what I would like to ultimately be able to try to address. Why is that happening?
Formally, I'm a mature 62 and a half, as they remind me, years old man, and I'm a psychiatrist. And I'm going to tell you that from where I sit, men are extremely immature. And I think that men have a tendency to play different kinds of games and play around with different toys. So maybe in the beginning, when condoms came about, originally designed in France to protect people from syphilis, and then it turned out that they are contraceptives, it was kind of like an interesting game. But then it turned out not to be. And like it or not, while we do have to teach the man that contraception is probably even primarily in the modern world is their responsibility, because they produce the sperm without which a woman cannot be impregnated. we have to push this idea and help them understand what is really going on. You'd be surprised how few understand it, actually. So male contraception idea has been on the rise recently.
The pill.
Well, so let's
Vasectomy.
talk to each other about what is humanly possible. So one of the earliest things that you refer to, Virginia, is what is called withdrawal. When a man orgasms, it happens outside of the vagina. Not very much taught, not very much appreciated and liked by the majority of men. Second thing to do is vasectomy, which means basically cutting off the tubing that connects sperm to the outside world. It comes now in two shapes. One is conventional surgery, and then it's reversible. If he wants to spend money, they can do surgery to reverse vasectomy. So it's second, more expensive surgery.
But you have to do it within 5 years or 3
Of course.
years. 'Cause you
So in
can't-
India right now, they developed a way when they basically clog the tube with a gel.
Vas deferens.
And it's probably going to go live in India in a year or two. I doubt it's going to go live and be approved by the FDA, even if they wanted to for a number of years. The third thing to do is to put on the condom, which is a relatively simple thing to do and can be taught, and I suspect...
So simple.
Yes, it can be taught, but people choose not to do it, which is a very stupid, idiotic thing.
Listen
Meaning,
up, listen up, guys.
But wait, can I
Yeah.
just say
Right.
here what we're also getting at
Right.
is we have created a culture
yes,
that men expect
yes,
that they will all that we have here's the thing.
yeah,
In the midst of that time, right, that you're saying feminism really is here, equal rights, all of
Right.
this, right?
It's-
At the same time, we have overprivileged the male
Yeah.
of course.
completely in the realm of sex.
No, no,
Yeah.
I'm with you on this
So
one.
so
far.
what happens there is
Right.
the male knows he puts a little added pressure, a
Right.
little like, oh no, I don't like this, or God, I wish you could. So suddenly who's responsible for blowing, so to speak, the intimacy, the right moment? And you're like,
Right.
and people will either
Right.
get annoyed
Because
or irritated.
stopping to bring out a condom isn't sexy.
Exactly.
So
Exactly.
when I was working at Columbia University, I heard that there were a series of demonstrations where people walked around saying no means no. So I think that needs to be pushed a little bit further. So the third way to control sperm production is by suppressing it hormonally. So what is offered on the market right now in the stages that are close to being approved are two things: a gel, which a man has to put on his forearms every single day, which contains a female hormone that is going to suppress testosterone production.
What, progesterone?
It's more complicated.
Okay.
And also testosterone. So the gel is called esterone testosterone. So it contains progestin that you like so very much, in quotes, right? And testosterone. So progestin suppresses the sperm production by suppressing testosterone. But clearly, if you suppress most of the testosterone in a male, he is not going to be able to have an erection. So they add additional artificial testosterone that is supposed to balance it out.
And it would all be so
Okay,
easy
so
just
basically,
to pull out.
Okay, yeah.
I mean,
And
right?
now- okay,
Let's just
another-
all start
okay,
taking
okay,
hormones
okay,
left and
okay,
right, which is
okay.
exactly what we did with women. And if this is the world, and we're going to do it with men. It's the same thing that happened around the pill for
Okay,
men.
so they are going to start the study in the US, UK, Chile, Sweden, and Kenya and Italy. That is going to involve about 420 couples to see how effective it is, and it's going to go for 12 months. There is also a pill.
This is what I've heard most about recently that
yeah.
I'm fascinated by.
So I would like you to understand that the pill has to be taken on a daily basis. Actually, the way these things work in males, originally people felt that it has to be taken up to 3 times a day because it gets destroyed very quickly by the body. They now came to the point when the pill is good for 18 hours and they think it's good enough. But again, what the pill is going to do is this, is going to introduce into a male body the thing that Virginia likes so very much, progestin, which is going to do exactly the same thing as
The negative side
the negative side effects, and some testosterone, so he can still function sexually. They conducted a study. At least one study had to be interrupted, not because the participants didn't want to participate, because the observers stopped them because of the side effects. So, but I would like to say the same thing about this that I keep saying about drug addiction, where I tell people the saving of the one who is drowning is the business of the one who is drowning. You need to yell for help. And men, before they start taking the pill, they need to want to take the pill. So I don't see how different that is to putting on the condom. Is it different?
So what I've heard is that from the test runs of the oral male contraception is that the men didn't like it because it had side effects similar to the effects of female hormonal birth control, which are things like, like mood swings, skin problems, acne, things like that. And they didn't like it. So the consensus from what I heard is that men don't want to take oral contraceptive.
No, that is true. But I'm saying no.
What surprises you about that?
I mean, it doesn't surprise me at all, but I think it's just so.
So who is the consumer with agency in that lineup?
Right, because it's like, okay, so a female can take.
Should take it. Look at the. I mean, what you're exposing is
exactly.
It's like saying, well, wait, this is all you got, sister. You're a consumer without agency. When we perceive the male, we all sit here and can kind of laugh together, kind of going, oh, men are never going to do that. Because why? Because men have agency and would able to say, no, I want something safer. I don't want to have to take something every day. I want, but are we willing to change behavior?
I have to deal with those side effects all the time. And it's like, oh, you're...
Yes, we need
But
to
there's
change.
a blindness to the female experience.
Yeah.
A total and utter ignorance and blindness.
So we need to change it. And we
really push that out.
Yes, and we live... I mean, maybe I'm too optimistic here, or call me naive. Please do call me naive, and I'll laugh.
So naive.
Yeah.
My goodness.
Yeah, I'm trying to laugh sarcastically here. But whatever it is, I'm really feeling very deeply that the times are changing. And the millennials and the Gen Z and whoever else is coming up are significantly more cognizant of what's going on. They appreciate each other. They do appreciate that while there are differences in their sexual assignment originally, in many ways they are very similar and have equal rights. Am I right? Or
Yes,
am
I think that's true. And I
no,
think
let's ask the millennial
sorry.
here. Do you think that at least it's happening somehow? So the hope I have is that men who sexually identify as men, whatever they are, heterosexual or gay or queer, doesn't matter.
Cisgender men.
Yes. Will start using whatever means are available at this very moment. And if somebody wants to sit down with me and teach them what can be done today not to impregnate the woman, I'll be very happy to do it, preferably in a public venue, so I don't have to sit down and explain to every single idiot that he can pull out and he can use the condom.
But I think also what I'd like to say about that is that it's also what we're trying to do is bring back, or at least what I am, and it sounds like you're interested in this as well. You're bringing back a real, we were talking about sex education. Does sex education truly teach you about owning your own body? Do you know when you could get pregnant? Do you know when those days are? Are you sure of those days? Does your partner know those days? So, for instance, when I teach fertility awareness, which is something that there's a lot of younger women who are interested in being not on hormones, but they want to know what's a more natural way of contraceptive control. There's a lot of fascinating stuff out there. There's herbs. There's just simple knowledge. There's the return of the rhythm method, essentially.
The rhythm is taking into consideration.
When you ovulate.
Yes.
And the days prior to ovulation
Yes,
are your
that's
most
the rhythm.
fertile days.
Yeah, that's the rhythm.
So what happens there? So when I fit what I call the V cup, which is a method I designed, which is a combination of the cervical cap and the diaphragm, and then there is the diaphragm. Then there's teaching women how to read their cycle and using apps that are that are available online. And you actually mark it, and your partner can also have the same app, so he knows when are you at your most fertile time. It is a joint effort. You have a calendar. I used to give these calendars out, which were birth control calendars. You basically put your fertile days, and whoever is initiating sex comes with the form of contraception. So if it's maybe something called VCF, which is a film that's very highly effective, or it's the diaphragm or the V cup or the condom, and you shift around. And then even if you get very good at this method, there are many days where you use nothing.
So I'm pretty sure there is an app that can tell you where your cycle is. But
there are lots of them. There are
Yeah,
lots
but know
of them.
about
But
these.
because we need to start wrapping up, I would like us to talk about two things. First, when you, Virginia, talk about it, there is a presumption that there is a couple that are dedicated to each other and live as a couple. We need to face a reality of life that also very frequently people are engaged in casual sex. When nobody cares about anybody, it just happens. And I think that in that case also, a male bears responsibility for a couple of things. Not giving a partner the disease. That is very possible, whatever that can be. And let's not undermine...
Syphilis, gonorrhea, and chlamydia are on the rise.
But there is also our other partner of sexually transmitted diseases that for some reason we don't talk as much about.
What?
Which is herpes.
Oh, herpes, yeah.
Yeah, which is not very good. Not very good at all. So,
And by the way, let us not forget, which people do forget. Can I just add this?
Yeah,
That herpes 1, the cold sores,
right.
if you have an active cold sore and you have oral sex with somebody, you can give it in the genital area.
So it would be nice for people to know that too. And also I would like to bring us a little bit into the realm of BrainStorm 9000's interest in brain functioning. So we are talking about all this stuff because all of this, without any doubt, affects our brains.
Absolutely.
Sex is very good for the brain. Good sex means good brain. I'm not trying to be funny here. It's a very known fact. Taking contraceptives does affect the brain function in one way or the other. And male not participating in contraception does affect the relationship and affects the life of a woman.
Just from my perspective, and I totally agree with what you guys are saying, that the male should be just as concerned with preventing pregnancy, in addition to STDs and things like that, as the woman.
At least equally.
At least
Yeah.
equally.
Yes.
But even in this modern time, when people, everyone is some kind of feminist, I just don't think that's the case. Like all of the boyfriends I've ever had, really nice guys, very supportive, feminists, none of them have taken this upon themselves. I remember at one point, before birth control had to be covered by insurance, I was paying $50 a month for it, and I started to get really resentful. And I asked my boyfriend, can you help me split this cost, or will you start doing this instead so that I don't have to pay all this money every month? Why am I taking this whole burden on myself? And he was a wonderful, wonderful guy, totally supportive, but it just the motivation to take responsibility for that just was not there. And I see that all the time.
Yes, but I think I agree with you. But I think that's what I was trying to get at. That issue, in my opinion, is more of a female, it's more the woman's problem.
What do you mean by that?
Because I think women take it on. And I think women are overprivileged. They take all of this on. And they take it on without identifying the enemy, without saying who's responsible, without drawing a line, without having boundary. They just take it on.
Yeah. Well, and because ultimately we have to. If someone gets pregnant.
Ultimately, we have to. But ultimately, we also have agency. We're also a little bit trying to sneak in cake and eat it too. Everybody's doing that now.
Yeah.
People suffer from that.
Mm-hmm.
It's a greedy way to be. And what I think happens is that you basically say, okay, because I'm getting something out of this, right? Well, you're getting something out of it by having no boundaries on your own body.
Yes.
And that's
so accurate.
Yeah. And so that's a real problem. And that's the divide. That's the split. That's the psychological split that's painful. And that's the psychological split that I'm interested in getting at in my practice. How do I empower my patients to actually look at that situation and say, why am I doing that?
So
why do I allow that to happen?
So what do you think is I guess if there is a solution or even a way to make progress?
Well, I mean, I'm an old Lyestra fan. It's like I often think that women need to have a sex strike. I mean, we need to make it, but we need to feel powerful enough to say, we have needs.
Yeah.
Women have started to feel less powerful because there are less men. They don't necessarily, in my opinion anyway, that I've seen, they're not always happy in this casual sex culture. Mm-hmm. They often want more of a relationship, but that's not de rigueur. So they go with the flow. Women are painfully adaptable, and women are painfully adjusting to life. We are girls in a pot, and I'm seeing it in the millennials, and I see it in my own age group. And that's a big problem. Women are taking on way more. They are not dividing the line and saying, you do it.
Yep.
I am not doing this. You do it. You want this? You have to share.
Undoubtedly, there are women who do put their foot down in that way. There are women who do stand up for themselves in that way, but I think what you're saying is very on point, that this sentiment is something that actually hasn't changed, even though we have this idea in modern culture.
Right. It's the split. Yeah. It's a false split. It doesn't exist. And so for instance, so for, exactly that. And then I think this is what's happening in the reproductive rights movement, is that they're gonna do this because we don't know how to stand up for this.
Yeah. No, I think that's really
and I think that's why we are floundering.
I mean, ultimately,
because it's false power.
Even this,
and we bought it.
Even
we act on it.
Solution is still, the burden is still on us. But that's what we got to do.
Yeah, and I also think the thing is that when you have young women who will, I meet them, women who say, I would never have sex with a man who wouldn't use a condom.
Yeah.
Absolutely never. And you watch that person, you think, whoa, really?
I've been that person before. And
have you watched yourself cave?
Every time.
Exactly. So that's what's interesting. Why? Why do we cave when we know, why is it the impulse? We can't have sex tomorrow?
Or we can't wait for the male to cave?
We can't wait for the male to cave? Exactly. That's what I'm getting at.
Yeah, no, I think
that's about?
That's a real issue.
That's what we have to examine.
Yeah.
Why do we cave?
Mm-hmm. No, I think that's fascinating. I love everything you have to say about this. And obviously, there's so much more that we could talk about. And I'd love to especially dive way further into the physiological, and psychological effects of hormonal birth control, which we'll definitely do another episode.
Yeah, I think we should definitely get Dr. Holland on the show, too, for this.
Yeah, so we'll absolutely, dive into more of these issues. But I think just what we've learned from Virginia today, and with Dr. Schultz's input about the male side, I think
Not
this.
only male side, I also spoke about female hormones.
Okay, so
Based
Dr.
on my
Schultz
experience in
speaking for everyone.
neuroendocrinology of a female,
Yeah.
mind you, reproductive
No,
axis.
those were really
Yeah.
good. I think that's very important. And I
Yeah.
think also that women have to be careful by voicing, saying, "Oh, why, let's get the male pill." It's like, really? Why do we want to do that?
Listen, it doesn't really matter.
Yeah.
I can tell you that we need to be clear on what I say jokingly again and again about the saving of the one who is drowning. If a person is not engaged in the process and doesn't want to be a part of the process, you can give them a pill, you can give
Yeah,
them
you
an
can give them
injection,
everything, but they're
you
not.
can give them hypnosis. They are not going to accept it. So it's not about the means of contraception. Think about females who have no access to contraception. They do abortions. This is a very dramatic experience. It's surgery.
Yeah.
Okay? So men need to be educated about how important their function is, and they have to become equal participants in the process.
That's
They
it,
need to
yeah.
understand the impact that they make on a woman,
And take more responsibility for
Yes.
their role in that.
or to take at least some responsibility,
yeah.
not
Even
just
to
the pleasure.
acknowledge it.
Yes.
That's,
Yeah.
I mean, that's really what we're saying.
Yeah.
So of course there is a
Simply
lot of
acknowledge it.
Yeah. So what is going to be our eudaimonia moment for today, Master McMaster?
So, as a woman, I think that's kind of a tough one today. But I think the eudaimonia moment that we can take from this discussion is actually the idea that sometimes, even most times, you can't really depend on cultural or social conventions or societal norms to support you in the decisions you make, be them reproductive decisions or other. Any decision when it comes to taking care of yourself. And in those situations, you may have to empower yourself, like the lovely Virginia Reath, who's such a strong, powerful woman. And you may have to empower yourself to make those decisions and stay strong and true to your convictions. And obviously this is, far more easily said than done. But the need for self-empowerment is a very compelling force and a motivator in the process of self-actualization and flourishing, I think. Also, fuck the patriarchy.
Thank you yet again for coming on the third time already
Yes,
here.
thank you, Virginia. You've
Thank
been
you very
such a
much.
delight.
Good.
So I think, we'll post more information about all of this for people who want to learn more about different kinds of contraception and the different effects that it can have and all things like that. We'll post some really great links and articles
Yes.
on our website, brainstorm9000.com. So you can go there to look into this more, and we are excited to follow up on this in the future.
Okay?
Sounds good.
Virginia, thank you.
Hey everybody, thanks for tuning in to another episode of Brainstorm 9000. If you like us, love us, or marginally tolerate us, hey, go ahead and subscribe, rate, and give us a review on iTunes or Stitcher or wherever the hell you listen to your podcasts.